Okay, we're live here in Baja. I'm John Spencer. I'm a microbiologist and immunologist. I work at Colorado State University, and I've been studying leprosy for the last 15 years. And I work with Claudio Salgado in Brazil. We have very few cases of leprosy in the United States, less than 200 a year. But in Brazil, it's over 30,000 cases per year. And I first met Claudio in 2009 at a meeting in Uberlândia. And the first time we met, we were sitting down together at a table at lunch. And we just started talking and just joking and laughing, and we kept saying, wow, this is amazing, come all this way and meet somebody. And it was like we were twins separated at birth. And we realized that we had a real strong connection almost immediately. And then he invited me to his institute at the Federal University of Pará, which is in the north, in the Amazon region in Brazil. And I visited his university in 2010 and helped teach a week-long course. And then we started interacting together more, and I was writing grants to support his research and survey activities in the Amazon. And so we started this collaboration that has continued, and it's been a very fruitful collaboration. Our grant support has increased over the years, so it's now becoming a real, very fruitful collaborating together, and we hope to continue our activities. So maybe you would like to speak about what you do and how we get together.
Well, my name is Claudio Salgado. I'm a doctor, and I work with leprosy since I was a student at the university. And in 2011, that's it?
2010.
2010.
Yeah.
2010, I met John Spencer in a meeting in Uberlândia, and as he told before, we there just discussed about many possibilities of working together, and I immediately invited him to come to my university, to come to my lab, to teach some techniques, basically serology, because they had this PGL1 molecule technique, and we are starting to do that in the lab, and this was very helpful for us. And finally, now we see that anti-PGL1 IgM for leprosy is not a diagnostic tool. It can help us, but from there, from 2010 until now, we developed other techniques, and we put together serology and geographic information systems. And some of my students went there to the United States, including there at Colorado State University. So this is a very fruitful partnership that we built since 2011. And I hope we can work in leprosy for a long time. We still have many cases. We still have many cases in Brazil. We are looking for new biomarkers to help clinicians to give the diagnosis. And we hope that we have some answers and some products in the near future for those that are working with leprosy patients in the field, where people live, especially in the poor areas with no access to different tools that we can deliver it to them and help them to make the diagnosis and to treat these patients there. Yeah, I hope that we can help people with leprosy for a free world of leprosy in the future. We know that this is a long way to come, but we are together in this line, and I hope we can continue to do that in the future.
Yeah. So, what Claudio has put together since 2009 is a group of clinicians, nurses, physiotherapists, research scientists, field technicians, and the state of Pará has one of the highest rates of new case detection for leprosy in all of Brazil, and it's really underreported. And what Claudio and his team does, we have up to 21 people go, and each team of 7 people can go to schools and households, and when we go to schools and diagnose children that have leprosy, they are kind of like the canary in the coal mine. And so when we diagnose a child, then we have to go to their house, and we almost always find index cases. The child got the disease from somewhere, so it's usually from grandma, grandpa, mom or dad, brother, sister. Somebody gave leprosy to this child. And so our focus is on children, diagnosing children in the schools, and then going to their houses and finding other cases where the infection is the source. And for example, in a 2-year period, we surveyed 4,600 individuals and diagnosed 387 new cases in children and adults. This is 8%. And this percentage is over 500 times Brazil's national average. And we had a video that I made the statement that this number is both astonishing and sad. And we've repeatedly come back to this and said this to Ministry of Health people and other health authorities in his region. And we hate to be ignored, so we keep repeating it.
Yes.
But the thing is, we absolutely need to have the health authorities listen to us, and we actually think that we are starting to make an impact, and they are starting to listen to us, and we hope eventually that things will get better with the health delivery system and the improvement of sanitation and poverty for these people, and maybe start to reduce the numbers.
Why is your work better because you're working together?
Well, I think Claudio really established what I think is the gold standard for active surveillance. So the biggest problem is that in almost all areas of Brazil, they rely on just passive surveillance. So people that get symptoms of leprosy will go to their hospital or clinic. Frequently they get misdiagnosed because there's not a lot of expertise for leprosy anymore. And then they keep spreading the disease more and more, and then they finally get diagnosed, and then they have other family members that are also diagnosed because it took such a long time. So our goal is to try to do active surveillance where we go out into the community and the schools and the households that are most impacted by very high levels of leprosy in the community. And this is, I think, the only way and the best way to really bring the numbers down is to go out there and find them, because it is very well known that active surveillance will always find many more cases than just passive, just waiting for them to walk in and say, look, I can't move my fingers anymore, I can't walk anymore, I'm disabled, because then it's much more costly. So if you can diagnose and treat the individuals much sooner, you will avoid all this cost.
What's the best part about working together?
We love each other, man. No, we've always had.
Years?
Caipirinha. Yeah, I wish there was some more beaches and, you know, go and enjoy the sun a little more rather than. No, it's hard work. I mean, we spend sometimes 14 hours a day going to the schools and then to the households. And we spend a week, and at the end of the week, everybody is completely exhausted. But we feel very proud about our efforts when we do this, because we are helping people in the community, and we are actually finding and treating little kids and their family members, and giving answers to people that say, I don't know why my doctor hasn't recognized this, but I have this serious problem, and what is it? And when you tell them, leprosy, you know, can be stigmatized, but in most of the time they are relieved because they finally know what the problem is and that it can be treated, and it will stop the deterioration of their health.
One last question. What, if you had to state your ultimate goal, what is that?
Well, first, I'd like to come back about the how we complement each other. I think it's well, I'm a clinician and John's a lab guy, and we complement each other because I have a view of the patient that I have to give a diagnosis for that patient, and of course, John comes with the view of the biomarkers that we have to search for, and we always discuss that, not only we two, but we discuss that with our team together, and there are always new ideas from the team, and I think this is one of the most interesting things with this group, is that it's really open, not open to other people, but open mind to test new things in the field to the patient. And the main goal, as you asked before, is just the patient. Yeah, of course, we want to diagnose it then as soon as we can. Not only us, but our work is with that. But going there and working with them, we learn from the patients, and we want to create new tools for our colleagues that are there to make the diagnosis early, because we cannot go to every place where there is a new patient of leprosy. So if we can help them, help the people that is there on the field to diagnose the patients early without any incapacity, then I think this is the main goal of our work. If we can do that, for me, it's fine, because we're going to break the chain of leprosy, of infection, and breaking the chain, you finally have less cases among the years, and finally, I don't know in how many years from now, we may start to see the number of cases going down. That's what is expected. Yeah? Okay.